Welcome, everybody. My speaker today is Dr. Camille Sinclair, who's going to be speaking with us about interracial dating issues. Welcome, Dr. Sinclair. Can you tell us a little bit about your work?
Thank you for having me, Aviva. I am a clinical and health psychologist, and what that basically means is I work with clients who are struggling with emotional issues, so typically trauma, anxiety, and some depression. And I also work with clients who have what we would call comorbid health issues, so health conditions that are also either exacerbating those emotional problems or the emotional issues are exacerbating their health conditions.
Great, thank you. What are some issues that you see that come up oftentimes between interracial couples?
Very good question. When I'm working with interracial couples, oftentimes there are communication issues between the couples, as well as sometimes there are boundary setting issues that tend to happen because of external forces, most often friends and families having opinions or issues with the interracial couple. And so sometimes there are those boundary setting issues that tend to arise in those couples.
And is it race specifically that tends to come up in terms of those boundary issues and things, or are there other issues that arise that are kind of related to race, but sometimes maybe not directly attacking the race issue or directed at the race issue itself?
That's interesting because when I'm working with these couples, it tends to be when the issue of family arise, it tends to be that there's a race and cultural differences that are difficult for family members to reconcile. And so oftentimes there are some stereotypes that are coming into the issue, socioeconomic concerns that are coming into that, and then just family dynamics that are typical of any blending family. So having to set boundaries maybe for a mother-in-law or a father-in-law, etc. But oftentimes with these couples, there is that tinge of race-related or even socioeconomic status-related problems that tend to come into the sessions.
Mm-hmm. Okay. What are some tips that you have for managing the issues between and within really the couple, the members of the couple itself, in terms of dealing with interracial issues that come up?
So the strategies that I often employ with my couples is helping them to begin to first communicate their needs.
Mm-hmm.
First, actually, let's go back a step to first identify what those needs are and the reasons that there's a struggle to communicate them to begin with. And oftentimes those are roots in developmental traumas or developmental issues. So before getting into a relationship, we're taking with us all of people say baggage, but we're taking with us all of those experiences that we've had. And the way that the brain is organized, we tend to build upon those experiences. We take in new information and we build upon our past belief and experiences. And so we're bringing our childhood traumas, our childhood experiences with us into relationships. And oftentimes that involves not pausing and reflecting on your needs and desires, and definitely not adaptively communicating them to your partner for whatever reasons. Maybe it wasn't a safe space growing up to communicate your feelings. Maybe you just never learned how to communicate your feelings. And so we bring a lot of those experiences into our relationships. So at first, I help my clients to identify their needs and desires, and then I help them to be better able to communicate them in a way that doesn't sound so accusatory. And that's pretty much with all relationships, regardless of interracial status or not. Oftentimes just being able to communicate your needs without an accusatory tone of you never, I always, things of that nature. And so that's how I help my couples to be able to communicate those needs and then build on what it is that the couple wants to value in their relationship. Each couple brings with them their own set of values, whether it be education, career, love, what have you. And so I help the couple identify what those values are and then help them move toward that end.
Wonderful. Thank you so much. What are some tips? You mentioned family, friends, right? Like these external people that sort of come into the relationship in particular, in a different way, perhaps in interracial couples than in other couples. And I wonder what tips you have for us on managing dealing with those people, those external people who feel like they
Mhm.
have a lot to say about your relationship.
Yeah. And again, when it comes to interracial focus, it's often race related. And so, particularly given the climate that we're in right now, I help my clients to be able to have the discourse because these are relationships with family members that they want to continue. And so, how can we have a respectful discussion without necessarily feeling as if a family member is overstepping or intruding and being invasive? How do you get that family member to be invested as opposed to being invasive? And that's oftentimes the wording that I use with my clients because their family is invested. Your mother is invested in your safety and your well-being. However, that can sometimes be invasive. So how do we delineate the two? One of the ways that I help my clients to do that is to ask them to have some empathy. And so we often do that in the session. What is your mother's intentions here? Is she trying to break you up just for breaking the couple up? Or is there something deeper? What are her drives here? What are the reasons that your mother would say those things about your partner? What is the reason your father would advise you in this way, right? What are some of the deeper needs that they have? And oftentimes it comes to protection and safety, right? As what parents do. Behind those behaviors, the function of that behavior is to protect your child. And so I have my client explore what could it be that your parent is trying to protect you from? And so oftentimes that's where we start getting to some of the stereotypes that underlie and underscore the parents' concerns, right? If we're working with a family, for example, let's say that there is a Black um, spouse or husband and maybe an Asian wife, right? And um, the Asian American family is probably having some stereotypes against the Black spouse. Well, what are they doing there? They're trying to protect you. Where did they get those ideas that we need to protect you from this man? Well, oftentimes there are stereotypes in our culture that says that Black people are dangerous and unsafe. And we might be open-minded people, but some of those belief systems absolutely infiltrate. And so your parents might be worried for you. And similarly, the other side, right? The Black mother of this Black husband might be worried about how the Asian American family is treating her son. Hey, they see you as dangerous, stay away, this is not a good relationship, etc. So both families are bringing in these stereotypical views and wanting truly to keep their loved ones safe. And so first, before we can even start tackling boundary setting with family, we first have to explore what are the intentions of your loved ones to begin with. And when you start looking at it from that perspective, you can gain a sense of empathy from that for them, and you can actually come to the conversation less angry and more willing to explore. And hopefully your family member can do the same for you. You might have to teach them.
Yeah, yeah. But I love that you're really coming from a place of kindness and compassion in the way you're talking about this. And I feel like that's so important and it's so hard, right? When we feel judged, especially in our relationships, for whatever reason, coming from that place of kindness and compassion, um, over time, I find that kind of gets to people more than anything else. It breaks down those boundaries more than anything else. Well, thank you so much for talking to us about this today. Where can people who are interested find out more about you and your work, Dr. Sinclair?
Absolutely. Thank you. I am on Psychology Today, which is a wonderful networking site for clients to be able to come and find potential clinicians. And so my last name is Sinclair. My first name is Camille. So clients can search for me there on psychologytoday.com and feel free to outreach with an email or phone call. And I'd be happy to explore the topic further.
And you are licensed in Colorado and New York, correct?
Yeah, Colorado, New York.
Great, wonderful. Okay, thank you so much.
Absolutely.